Today on Investigate TV Plus, where you live could affect your risk for a disease. It's a reality gaining momentum in the U.S.
Does the idea of getting diabetes scare you?
Yes. Oh, yeah.
We travel to two cities just 60 miles apart and hear the stories of people facing different battles for their health and the solutions designed to help them all.
Plus, teachers under attack.
I'm afraid to go back in there.
We examine why and dig into a solution already underway to protect educators and students.
Then, a life-saving legacy.
As a kid, I remember my mom getting up every day and her famous line would be, "I gotta go save a life."
We share her inspiring journey following in her mother's footsteps.
In-depth stories that inform and inspire. You're watching Investigate TV Plus.
It's one of the fastest growing diseases in the world. I'm T. Chappelle.
And I'm Lee Zurich. We're talking about diabetes. According to a 2023 study, the number of people with a potentially deadly condition is expected to double in the next 25 years.
Unlike chronic diseases like cancer, Alzheimer's, or even arthritis, many people can reverse their risk for type 2 diabetes with diet and exercise.
So why is it such a pervasive problem?
Investigative reporter Kristen Crowley went to Colorado in search of that answer. It's the state with one of the lowest rates of diabetes in the nation.
There she found neighboring towns with major diabetes disparities and shows us some of the promising strides that could help millions facing the disease.
Okay, so my name is Letitia.
Karen, Sierra Howard.
Let us introduce you to three people in two different parts of Colorado with one major fear.
Or are you afraid of getting diabetes?
Yes, very afraid of getting diabetes.
Oh, for sure. Once you know one person with it and you see all of the side effects and things that can happen to them, you're like, I'm a little worried.
Does the idea of getting diabetes scare you?
Yes. Oh, yeah.
Why?
Because I want to be healthy.
Letitia Rodriguez, Sierra Howard, and Karen Buffalo all have a family history of diabetes, and they have good reason to worry. When you have diabetes, it means your body doesn't produce enough insulin or can't use it properly, and it can be deadly. It puts people at risk for cardiovascular disease, kidney failure, and organ damage, especially when untreated. An estimated 38 million Americans have diabetes, and a whopping 96 million have prediabetes, Karen and Letitia included.
Didn't feel anything, so hearing that was hard.
But for many people, it's preventable with a healthy diet and exercise. The friendly outdoors of Colorado has a lot to offer, from biking and hiking to camping and water sports. It's one reason the state touts one of the lowest diabetes rates in the country. But even in a state with seemingly easy access to the outdoors, economic and cultural barriers can get in the way.
I hope they do more cooking classes though.
Sierra and Letitia live in Weld County, where its largest city, Greeley, has a diabetes rate of 14.2%, a number not just higher than the state of Colorado, but most states in the country. It's more than double the average of Denver's rate.
There's lots of opportunities, to get out and get active.
Public Health Communication Manager for Weld County, Kelly Martinez, says time and money often stand in the way of some residents' healthy lifestyles.
What if you don't have transportation to get to the mountains? What if you don't feel safe walking around your neighborhood? What if you live in a food desert and it's really difficult for you to get healthy foods?
There's a pretty big disparity for the diabetes rates.
Correct.
Why is that?
There's pockets that just aren't being served because of the financial and language barrier, more prevalent here in Weld County.
Nationwide, minorities like Hispanics, Blacks, and Native Americans are at greater risk for diabetes than others. Research shows that's because they often live in neighborhoods that lack access to healthy food and healthcare to get preventative services. Martinez says in Weld County, about 17% of its Hispanic population has diabetes, compared to 10% of its white population. She's on a mission to reverse Weld County's rate. In fact, the entire state wants a lower rate, because even though it has one of the lowest in the country, the disease is still on the rise.
Colorado is the leanest state.
Dr. Ned Colon is Colorado's chief medical officer.
However, I always point that it's like being the best of the worst, Being the leanest state doesn't mean we're lean.
In 1996, Colorado's diabetes rate was less than half what it is today, at 3%. 4 years later, that jumped to 5.1%, and it's steadily increasing.
We know what causes it. We know how to reduce the risk for it. Why are we still seeing rates increase?
It's way easier and less expensive to eat poorly than it is to eat well.
So how does the state slow down this growth trend? By growing its diabetes prevention program through the Centers for Disease Control and Prevention.
We took people and found that if we had them diet and exercise, we actually reduced the progression to type 2 diabetes by almost 50%. And that's where diabetes prevention really took off.
The YMCA runs diabetes prevention programs in person and virtually in portions of the state.
Keep the plate visual in your mind.
Karen is taking it for the first time.
You kind of learn about portions, how much to eat, how much is good for you, what are good options. You know, I think before I kind of knew more fresh foods, less processed, but then they add to that.
She's already seeing a difference.
The weight is down 9 pounds, so that's really good for me. My A1C will test it next month, but my doctor said she's sure it's going to be lower. The numbers are there. We know that this works.
Amy Sagendorf, who helps run the program through the Y, says most people who take the course have similar outcomes like Karen, but only a fraction of those who need it take it. Back in Weld County, for the past 5 years, people could take the program through the health system, but it would cost them up to $600. In an attempt to break down economic and cultural barriers, for the first time, the program is now free and in Spanish for the population most at risk.
Our goal is to reduce the diagnosis of diabetes by 5% within the next 5 years.
We're going to do a class once every month.
Letitia's walking proof change can happen. She's no longer pre-diabetic.
If it weren't for a diabetes prevention program, do you think you would still be pre-diabetic?
I think I probably would be pre-diabetic still.
Now her goal is staying that way and hopefully helping Weld County reduce its numbers along the way.
Weld County has already seen some success. Its rate was more than 11% when we started working on this report. After our interviews, new numbers from the state show it's dropped to 9.4%.
As we mentioned, this is a national problem.
The CDC partners with hospitals and wellness centers across the country to offer its diabetes prevention program.
It's a year-long course available in person or online. The cost depends on the specific program and insurance coverage.
You can find an in-person program near you or explore virtual options. We have that link on InvestigateTV.com. Just search Diabetes Disparities.
Still ahead, home maintenance costs are through the roof, and keeping up with repairs is definitely its own job.
I didn't really realize how much time I spent on the house.
But with some simple tasks and time, you could avoid breaking the bank. We'll show you how.
But first, classrooms in crisis. Student violence against teachers prompts one district to rewrite the book when it comes to behavioral health.
You can watch Investigate TV Plus anytime streaming online. Get the app for Roku, Amazon Fire TV, and Apple TV. They're free to download.
I'm afraid to go back in there. And I can't trust the children.
It's hard to watch teachers slapped, kicked, and punched by their own students.
That student went to my desk, grabbed a sharp pair of scissors, and threw them at my face.
According to a 2024 study, violence against teachers is on the rise. In a survey of thousands of teachers, 80% said they experienced verbal threats from students, and more than half reported physical violence.
We get threatened all the time. It's not, okay.
I hope you get hit by a car on the way home. I've had kindergartners tell me that.
While reports of violence have increased, experts say the issue isn't a new one. In 2010, the lead author of the study found 42% of teachers experienced physical violence from a student.
It's been a problem for a fair amount of time over the past 15 years.
Experts say remote teaching during the pandemic led to a drop, but when in-person learning resumed, both physical and verbal violence against teachers spiked.
We're telling you there's an issue here. Please don't let this continue falling on deaf ears.
A school district in Oregon was no stranger to this kind of violence.
Salem-Keizer Public Schools is the second largest school district in the state. Our investigation found between 2019 and 2023, there were more than 1,000 reports of staff injuries.
In the search for solutions, Salem-Keizer teamed up with a child mental health facility to bring behavioral health services and daily studies into one location.
Reporter Adrian Thomas shows us how the partnership is designed to keep teachers and students safe.
In a repurposed elementary school building in North Salem sits the Meadowlark Day Program, a behavioral health facility operated by a team of therapists from Trillium Family Services and Salem-Keizer staff. Chi Blatt oversees programs like Meadowlark across the state, which provide professional mental health services for students along with their studies.
So we're checking in to see how each person is doing, how each staff member is doing, and setting goals to kind of have forward movement in their day. From there, they're transitioning into their classroom setting. So once school is getting started, they'll be able to go into their classroom structures that will look fairly similar to what it will in a classroom as they return home into the mainstream school system.
Blatt says students typically spend 2 to 3 months in these kinds of settings with the goal of being able to return to their original school. Students can be evaluated to enter the program after being referred to Trillium by a school counselor. It offers a safe space for students with the greatest mental health needs.
What is it about this approach that you believe is successful and effective?
The motto that our team holds clinically is that we are going to have the classroom setting where the teachers really kind of focused on progressing the educational component of what we do here with the overlaying process of the mental health interventions.
From Salem-Keizer's side, Director of Mental Health and Social Emotional Learning, Chris Moore, is also helping oversee the program. We spoke to him in our continuing coverage of student-caused teacher injuries in the district. At the time, Moore told us that they employ a team of behavior intervention trainers who train staff in de-escalation tactics and who respond when a student physically lashes out toward a teacher. Moore says the district has added a second behavior intervention center where students who harm their classmates or teachers can continue studies in a smaller, more supervised setting, but without the clinical element like the Meadowlark program.
With those 3 entities that exist now, with the opening of this place, will it meet the need?
We're not even close. We could open up 5 more of these programs today in our area, and there is definitely a level of need. Where we would have trouble to open those 5 programs tomorrow is having an adequate behavioral health workforce.
With the Meadowlark program receiving state funding, Moore hopes this program can set the tone in offering resources to K-12 students with the most severe mental health needs.
What we've really seen too is just the level of support in the community for this project, inspiring others to look at our system a little bit more critically and how our behavioral health care continuum of care doesn't work for most families.
While still a concern, Moore feels the actions the district has taken to provide resources for the most troubled students will have an impact, and that he's committed to addressing the concerns of Salem-Keizer teachers.
We're going to come alongside folks and listen, but also act and make sure that we're following through with what we say we're going to do. If we're talking about staff injuries, that we have actionable steps that we're taking so that those 1,300 plus staff injuries that were part of our record last year, that we see those drop.
According to the contract between Salem-Keizer and Trillium, the program's goal in its first few years is to serve about 100 students per school year. Reporting in Portland, Oregon, I'm Adrian Thomas.
The effort to bring health care to students doesn't end with mental wellness.
Some schools bring physical health resources to their students. About 60 miles southeast of Cleveland at Warren City Schools, you'll find nurse practitioners who provide services including physical screenings and vaccine updates. The district says it contracted these services from Akron Children's Hospital for families who lack access to a primary care physician. The program is free for students. Still ahead, walking in her family's footsteps.
Ultimately, she was my inspiration.
How she's fulfilling a lifelong dream in memory of her mom.
But first, home repair despair. the costs that add up in time and money.
Everybody says, how's retirement? I said, I don't know. I'm working on something every single day.
We'll show you how some sweat equity could save you big bucks down the road.
Our in-depth coverage continues. You can get connected to Investigate TV Plus on all social media platforms. From a hole in the drywall to a leaky pipe, the repairs that come with home ownership can feel endless. According to a 2024 survey, each year the typical American spends nearly $7,000 on home maintenance.
The same survey found between 2022 and 2024, the cost of home repairs increased 8% year over year.
As maintenance costs climb, there are things you can do right now to reduce wear and tear and possibly save money in the long run.
Reporter Susan Campbell takes us to a home in Arizona to show us how.
You have some gaps.
Bob Morrison has lived in his home and loved it for 18 years.
I didn't really realize how much time I spent on the house until I retired in January. And everybody says, how's retirement? I said, I don't know. I'm working on something every single day.
He's a cost-conscious homeowner and makes sure everything here is regularly maintained. Air filters top the to-do list.
Religiously, almost every 30 days, they all get replaced.
The filter is there.
You should do the same thing in your home. According to the Department of Energy, replacing a dirty filter can cut your AC's energy consumption by 5 to 15%.
Just unscrew these. The filter is there. You remove it. And then there's an arrow. And then you want to put the arrow facing towards where the airflow is going.
There are a few other places around the home where regular maintenance can save you in the long run. We walked through Bob's house with experts from APES, HVAC, and plumbing. Next stop, the refrigerator. You'll have to pull it out from the wall.
This is your vent here. You don't want anything covering this. We can clean them out by removing these panels here and blow air into them to keep them clean. Keep the area around it clear.
Onto the bathroom, clean the exhaust fan for proper airflow there too.
You can actually just pull it off. It has tags on it. Once you pull it off, you just clean it with a vacuum or a brush.
To the kitchen now, where the garbage disposal could cost you if you put too many food scraps down the drain.
That's going to lead to a lot of backups, bad odors in the drains, and then when your drain just stops going because you've built up all that food in your drain, you have to call out a plumber to come out and snake that. Can cost over $200.
So clean the garbage disposal regularly and run plenty of water when you use it to get those scraps out to the main line. And finally, the water heater. Flush it every year.
Sediment inside of it, even just 1/8 of an inch of sediment can make it have to work 70% more, so it's using 70% more energy to just heat the water inside.
And look for leaks too.
Like on this water heater here, you can see there's a little leak on this valve, so that valve should be replaced because you're losing little drops of water, but that's going to add up over time and cause potential water damage, which costs you a lot more.
Just add it to Bob's list.
Some more expert advice? Replace your smoke alarm batteries twice a year. Clean your gutters at least once a year to prevent blockage, and inspect your water heater.
Still ahead,
911, what's your emergency?
A young woman answers the call.
I've been completely dedicating my life and my study and my career and everything to making sure that I live on with her legacy.
The inspiration behind her motivation to save lives. You can watch Investigate TV Plus anytime online. Just subscribe to our YouTube channel at Investigate TV. You can catch stories and full episodes.
Working as an emergency medical technician, or EMT, requires quick thinking, the ability to adapt, and most of all, care.
In 2011, at just 37 years old, a St. Louis area EMT who embodied all of that tragically died on the job.
Reporter Caroline Hecker shows us how almost 15 years later, her daughter is honoring her mother by saving lives too.
She'Erica Wilson was born for this. As a part-time EMT for Northeast Ambulance and Fire, she's living out her childhood dream.
Halloween was my favorite time of the year because I get to dress up like my mom, because ultimately she was my inspiration.
She'Erica says she and her mom, Cherise Bishop, practically lived at the firehouse. Cherise was an EMT.
As a kid, I remember my mom getting up every day and her famous line would be, "I gotta go save a life."
But while on a call in 2011, she suffered cardiac arrest while giving CPR to a patient. At just 37, the news was shocking.
You know, you get the call for that, hey, we're coming to assist. When you're like, okay, what do you need? And like, no, she's down, so then it's all hands on deck.
She died a few days later, and since then, her daughter has made it her mission to help others.
And I've been completely dedicating my life and my study and my career and everything to making sure that I live on with her legacy.
She'Erica will be hired on full-time by the department, having completed her paramedic license and ready for the fire academy.
So we keep those in here.
Those around her proud to see the little girl who once ran around the firehouse now living her dream.
Kind of euphoric, to watch her on her journey as she got to this point.
And her journey is just getting started.
I love that, a dream coming true for her, but also, honoring her mom in a way by doing that job.
Yeah, and it's also exciting to see the people that her mom worked with, see her daughter carry on her legacy.
Very nice. All right, that's it for us here on Investigate TV Plus. I'm Lee Zurich.
And I'm Tisha Powell. Thanks for watching.
On the next Investigate TV Plus, when new baby products hit the shelves, we found they're often sold without government oversight or testing.
The fact that anyone can just make an infant product and put it on the market is really scary. And there is this assumption that if something's on the market, then it's safe.
We examine how this happens and why experts say it needs to change.